How would you like to have each person in your organization not just understand your vision for new healthcare initiatives, but take action on them? Right now, healthcare in the United States is going through a time of critical change. Any leader in the healthcare sector could tell you that. In fact, many leaders have great plans on how to change and survive these times. The problem is, so many leaders are great at developing plans, but terrible at spreading them through the organization. Some sectors may be able to get away with this, but with HCAP scores being tied directly to reimbursement, healthcare just can't afford to have this kind of disconnect. Former Secretary of State Colin Powell sums it up pretty well. He says, great leaders are almost always great simplifiers who can cut through argument, debate, and doubt to offer a solution everybody can understand. Critical word, everybody can understand. Walking into many healthcare systems today, it's hard to miss the worry and anxiety. It seems like reimbursements are being cut while standard of care has to be increased. In other words, doing less with more. The good news is there are great leaders and strategists in many organizations coming up with new ways to make this work. The problem is so much of their plan is lost in translation that the rest of the organization often doesn't get a hold of their vision. Like the old saying says, change is inevitable, progress is optional. The truth is, many leaders in the healthcare space don't need a new solution to their problems. They've already figured it out. They need a new way to tell the rest of their team about it. Otherwise, nothing happens. My name's Lance Johnson. I'm the co-founder of Whiteboard Geeks. In the next few minutes, I'm going to share the system my clients use to first break down their new ideas and then get their team excited about it, and how you can do the same. I'm also going to share with you the biggest mistakes hospital leaders make when trying to communicate a new initiative, the two things the best hospitals in the world use to get their people on the same page that many miss, and a straightforward research-backed system to get your ideas to stick in the mind of your organization and get them to act on it. Now, these are the exact same strategies we've used to help multiple major healthcare companies break through the boredom and fear many team members have and get their important message out. We're committed to helping hospital leadership communicate important ideas to their organization in a way that breaks the boring mold everyone has seen in the past. So if you're a hospital or healthcare system C-level executive, VP, or director who has struggled to get organization-wide buy-in in the past, and you're looking for a way to break through the mental blocks that make it hard to spread new ideas, this presentation may be relevant for you. The top 3 people we work with fall into one of these categories. First, they might be an organization leader trying to spread a new idea or move an initiative forward. Second, they might be CMOs or VPs of marketing looking to bring a new idea to their customers or stakeholders. Or third, they might be a chief learning or a chief talent officer looking to increase training, effectiveness, and retention. Now, one of our clients, YALE New Haven Health, needed to explain population health in a way their whole organization could easily get. This was a big change to their business model, and there was the potential for a lot of worry around it. On top of that, if they couldn't get employee buy-in, their engagement rates would suffer, which instantly impacts HCAPs. After working with their senior leaders to clarify their idea, we helped them to distill it into its core elements and wrap it in an easy-to-digest and motivate package for their entire organization. Another client of ours, the Cleveland Clinic, recognized that the landscape is shifting, but they needed help pushing it throughout the organization. They really impressed me with how committed they are to boosting quality of care at every level, and they know this message needs to break through in a new way. In addition to top healthcare systems, pushing out new ideas has also been critical for our partners at GE Healthcare. When they came to us, they had an important idea, but getting internal buy-in can be tough. Now, fortunately, our style and method for simplifying ideas help them push their initiatives out to the whole organization in a way that helps everyone understand why it matters. The beautiful thing about this process is it brings a fresh approach so your employees don't instantly shut off or ignore your message. It helps large organizations that move slower than they'd like to get excitement spreading organically. When Ethicon from Johnson & Johnson launched a similar idea campaign, it spread like wildfire through their firm, which was exciting to see. Plus, it has worked with other healthcare and even medical device organizations. If you've been in this industry for any amount of time, you've probably seen that healthcare leadership usually falls into 2 categories. The do this because I said so camp. These are people who think that saying this is what needs to happen instantly makes it so. These people try to force change by brute strength. Often they fall flat and are all about their own ego. This is the us versus them mindset. the executives versus all the other employees. And a lot of times this attitude comes out when it's always about quote unquote difficult to motivate doctors or intractable nurses. Now, the second camp is the lead with logic camp. These are people who show the organization why this is important and lead by example. These people end up having a lasting impact on their organization since everyone actually follows the changes, even when they're not being watched like a hawk. Instead of us versus them, it's us versus the problem. Now, obviously, no one starts out to have their message flop. Most of the time, they even have an idea that can make a lasting impact on their hospital or health system. In fact, odds are good that you rose to the position you're in because you've got higher than normal work ethic and higher than normal intelligence. So why do some smart leaders bore their teams to tears, fail to get their message across, and in rare cases even have to step down due to inefficient steering? Well, most leadership teams are great at coming up with a new strategy to handle all the changes we're faced with. The problem is, so often they spend a fraction of the mental effort getting the buy-in for their ideas as they did developing them. Or they're focused on some new technology that will revolutionize their standard of care. But let me ask you this. In all your years in the healthcare industry, have you ever seen a technology that completely lived up to all the hype? Yes, there have been vast improvements. But at the end of the day, the key factor in a successful hospital or healthcare system is engaged people. Many people think that a lower workload, by way of decreasing the number of patients seen per day by a nurse, is the best way to boost engagement. But a Gallup study of 200 hospitals found out the number one factor for decreasing mortality is nurse engagement. Many administrators see that fact and think, guess we need to make our staff's lives easier. But the fact is, it's not an easy job they want. It's one that matters. You already have the ideas to improve the lives of your patients and staff, but do they know about them and truly understand them, or do they instantly turn off and go into boring presentation mode when you try to explain them? Remember at the beginning I told you there are two things the best hospitals in the world have in place to communicate their vision throughout the whole organization, and that so many others are missing it? The first thing is clarity. Their entire staff knows what this new initiative is and why it matters. They can explain it to their spouse or friend in 2 sentences or less. Second, and most often overlooked, is urgency. Why this matters right now. The best hospitals don't say, this may affect us sometime in the future. They say, this will affect us in the next 6 to 12 months. So let's get down to business and show you how to get your ideas and initiatives through today. If your organization isn't getting employee buy-in for your initiatives, let me ask you 2 questions. First, how clear are you on where you need to go from here? And second, how clear are you on what will happen if your system doesn't make this change? Because it comes down to this. Hospital leadership has a lot vying for your attention. Things that are urgent are rarely important, and your people run into the exact same problem. When needed, top leaders cut out the noise and focus on getting these 2 things. The fact is, the healthcare landscape is changing fast. The organizations that can see the right path and then steer the entire ship onto the new course will be the ones that survive, while ineffective leaders are hoping their employees will catch the vision and change will somehow trickle down. But there's always the plan B of being acquired by a larger system. But let's jump back on to spreading ideas. What does this system for getting ideas out look like? When you have a predictable model for getting new ideas out and getting your organization to take action on them, you can move more like a nimble startup, but still have the resources of a respected and established healthcare system. The result is, instead of boring your team to tears with initiatives that only you are excited about, you can break through and get bigger buy-in. To get this system to work properly, you need 4 things. These 4 things are 1, an inspiring idea, 2, a boredom-breaking delivery method, 3, why does it matter handlers, and 4, urgency. When you put these together, your organization can change much quicker and be happier and more engaged while doing it. This is the exact reason Z Omega is using this system to get bottom-up buy-in for important population health programs, motivating employees on the front lines as well as the boardrooms. Again, Yale New Haven Health needed to explain population health in a way that their whole organization could easily get. This was a big change to their business model, and there was the potential for a lot of worry around it. On top of that, if they couldn't get employee buy-in, their engagement rates would suffer, which instantly impacts HCAHPS. After working with senior leaders to clarify the idea, We help them distill it into its core elements and wrap it in an easy to digest and motivate package for their entire organization. And another client of ours, Cleveland Clinic, recognized that the landscape is shifting and shifting fast, but they needed help pushing it throughout the organization. They really impressed me with how committed they are to boosting quality of care at every level, and they know this message needs to break through in a new way. The thing about it is, these results don't happen by luck. Each message is a puzzle, kind of like a combination lock. The problem is, a combination lock has over 10,000 possible combinations. You can try them, or you can piggyback off our specialized work. This is the only problem we work to solve. You call a locksmith for locks, you call us for messages. That's not to say you'll never figure it out. You clearly would not be in leadership if you were incompetent. But if you'd like to shortcut the message success, this is where we can help. You might be wondering, how can I get my initiative to be exciting enough to break through the clutter and urgent enough to provoke action? This is the perfect question if you're planning to roll out an initiative that will help cut costs, increase HCAP scores because of staff engagement, move your hospital into the next phase of meeting consumers where they're at, or quickly establish your organization as one of the dominant healthcare pioneers. The fact of the matter is, we're looking for a few more dream partners who are looking to have a big impact on healthcare. We have Yale New Haven Health, Cleveland Clinic, and others on board. That's why, if you meet a few important criteria, we'd like to have a message strategy session with you. We're only interested in speaking with leaders who have an important vision to communicate. You can dress up a boring, uninspired vision, but it's still a boring, uninspired vision. 2, leaders who want buy-in on initiatives all through their organization rather than a totalitarian because I told you so approach. And 3, leaders who have an urgent reason to get their initiative out quickly. Here's how this process works. We'll be focused on a specific and custom-tailored strategy and execution method to help you solve the 3 biggest problems leaders face while trying to spark change and new ideas in a large organization. First, breaking through the noise, business, and stress so the idea can actually be heard. Second, making the idea simple enough to understand for it to stick in your mind. And third, showing why this is an urgent problem and why change is important now. This idea strategy session will take about 30 minutes. We'll help you isolate the core of your message that you need to spark change, which is especially important with the way the landscape is shifting right now. So who is this for? It can be for hospital administrators or leaders, communication directors, leaders who already have an important idea they need to get across. We can help you clarify and prioritize your good idea, but we can't come up with it for you. And for people who see the value in investing in spreading their message. Our product is not cheap, but we will not hard sell you. If you don't value spreading this idea in the 6-figure range, there is nothing we can do to help. And for a basis of comparison, some top institutions invest heavily because they see the value behind this approach. Now, this is not for people who want to force their team to embrace the idea rather than getting organic buy-in, or organizations who are afraid to be leaders in spreading their ideas. If you do the same presentation as every other healthcare system, you'll get the same results as every other healthcare system. Or for people who are stuck in information gathering and need 6 to 12 months before they're prepared to take action and start this initiative. And finally, for anyone who is not serious about improving healthcare as a whole, the end goal here is to internally spread ideas that motivate your whole team to improve patient outcomes, which in turn saves money and increases your profit by giving your hospital a competitive edge. Now, these criteria may sound strict, and the truth is they are, but here's why. At the beginning of an initiative, everyone is happy and it seems like nothing could possibly go wrong. But fast forward to the middle of the project, and if there was a mismatch on values at the beginning, the whole thing goes south. You would have wasted your time and we would damage our reputation. We only want to work with customers that we can help get great results for. The first step in the application process is for a confidential strategy session by clicking the link below. This is important to determine 1, that we are the best team to help you generate results, and 2, that you're planning to partner with us and do the work needed on your end to get these results. Once we receive your application, you'll be able to schedule a time to conduct your confidential strategy session. This is where we'll do some of the initial grunt work to figure out exactly what your goals are and how to predictably make it happen in the shortest amount of time possible. At the end of this session, one of 2 things will happen. Your organization will either be a fit, and we'll extend an invitation to work with us as one of our customers, or if it's not a fit, we figured it out early in the process, and we might be able to refer you to someone who can help. There's no hard feelings or obligations either way. Either way, you'll come away from the strategy session with more clarity on what the next step is to build urgency into your system and help your organization spread your new idea and get employees more engaged. Plus, it can help remove any roadblocks that were slowing down your message and keeping it from exciting your employees. The other part is our method for brainstorming and clarifying ideas can be downright fun. This could be the most productive 30 minutes of your week. Now, full disclosure, due to the personalized service and our need to dive deep on your project, we can only take on 6 new clients this month. Each month, we have between 100 to 200 people apply to become a client, which unfortunately means most people are turned away for various reasons. So please understand that we are not trying to pressure you, but simply know that our window of opportunity to work together closes quickly. And often with these time-sensitive initiatives, waiting 2 months to start is not an option. If you feel like this is right for you, go ahead and click the button below and apply right now. The process is simple and it should take less than 5 minutes to complete. Click the button below now and follow the instructions on the next page.